There are a few reasons. So first and foremost is when that patient comes into the provider's office, they may have 15 minutes of time with their provider optimistically. And in many cases, uh, they don't have the opportunity or the ability to tell you everything that's going on. For whatever reason or another, provider comes in, they get nervous, they're intimidated. Nobody likes telling their doctor they're not adherent or that they're not following the guidelines that are objectively relatively easy on paper and they know they're supposed to be doing. So they oftentimes will not be fully truthful. That's one reason. Another reason is the provider themselves can only do so much in 15 minutes. And if you think about a patient that comes to see their nephrologist 4 times a year, they've got 361 days where they're managing their care on their own. And most people are not going to be able to follow their medication guidelines or their dietary guidelines, especially if they're a Medicare aged patient. So the importance of them having somebody that they're comfortable with is multifold. First, it's that that person has a better understanding of what that patient is dealing with day in and day out. That enables you to identify things like social determinants of health that are impacting that patient's care beyond what you might see when you're in the office. As we know, Z coding is increasing in importance. The reason why is because, as an example, if someone is isolated, we know that it's going to increase their likelihood to worsen their chronic conditions. If somebody is low in financial status, we know that they have a higher likelihood to be more comorbid. The list goes on and on. You do not identify those things by simply asking a patient, hey, do you struggle with your finances? You do it by developing a relationship with them over time and getting a better understanding for what are their eating habits? What are the foods that they're consuming on a regular basis? Why are they consuming those foods? Are they able to exercise? Do they have access to transportation? All of those things now paint a picture about that patient's life that are oftentimes overlooked during the course of an office visit, but they're extremely important to that patient's health outcome. I'll give you an example. We have a client who a patient was a diabetic, and they were extremely compliant based on everything they shared with the doctor during their office visit. They took their medications, they followed the insulin, they took their food exactly as they were supposed to. Yet every single visit they came in, their A1C was off the chart and it looked as if they weren't doing anything. It was only identified that the patient actually didn't have electricity in their fridge because their fridge was out. Well, what we know is that if you can't keep your medication, specifically your insulin, it becomes useless. So for years, that patient was taking their medication as they were supposed to, telling the doctor that they were doing everything they were supposed to, but their health condition got worse and worse and worse. It only was found out once they admitted to a care manager, hey, I don't have electricity in my house and my fridge has been busted for over a year. Did they identify why that patient was so non-compliant? It wasn't non-compliant. It was that they're dealing with a financial constraint that made it impossible for them to be compliant. The next step was the care manager was able to get them a social resource. That social resource helped them get access to electricity and a new fridge. All of a sudden, the patient came back in for their appointment and their A1C was right within normal. Those are examples that are happening every single day that have a significant impact on your ability to deliver care and drive outcomes for your patient that most providers will never understand about their patient. Only when you develop a relationship with a patient outside of the walls of your clinic and they feel comfortable sharing these types of personal information and things will you be able to really understand all of the things that go into impacting that patient's health over time. And it can be something as simple as them just not having a working refrigerator.